Dr. Kate Tulenko joins me now from just outside Washington, D.C. She's the founder and CEO of Corvus Health. Great to see you, Dr. Tulenko.
Nice to be here. Thank you.
Well, how much progress has China made in decreasing the impact of birth defects? Talk to us about some of the changes that we've seen in the last several years.
Yes, China has made great strides on reducing birth defects. Some of the major changes they've made is making folic acid available free to low-income women. This prevents spinal defects such as spina bifida. They've also made pre-pregnancy screening available for couples who are planning a pregnancy, and they've also done traditional testing of newborns, looking at the metabolites. And your story covered the new form of testing, which is genetic testing on newborns, because the earlier you can identify these inborn errors of metabolism, the earlier you can intervene and ensure that the child will not suffer the bad consequences of their birth defect.
And talk to us about some of that screening. And you touched on something else, prenatal care for women. Is that something that just wasn't done in recent years, like taking the vitamins, the folic acid, some of the things that mothers can do to make sure they have a healthy baby?
I think many women didn't realize how important it was. I think many women, especially rural women, thought, I'm healthy, pregnancy is natural, I don't need to see the doctor. But we really do want all pregnant women to see a midwife or an obstetrician or the family practitioner as soon as they know that they're pregnant, to make sure that the woman is healthy and also that the pregnancy is healthy. For example, it might be, a pregnancy that's in the fallopian tube, which is non-viable and needs to be removed. And in looking forward to China, there's some, high-tech and low-tech interventions that can be made. The high-tech ones are, these new genetic sequencing, including sequencing of fetuses, genes from the mother's blood, and also, some of the older higher tech things such as ultrasound to detect earlier the defects. But also China needs to do some of continue to do the low tech, such as better controlling diabetes and obesity in pregnant women, because these are a major cause of congenital heart defects.
Right, because there are several, I guess, different categories. When you look at the different birth defects, there's biological or hereditary, as you mentioned, some of the testing for screening for genetic defects, but there's also the environmental piece of this and how much the environment can contribute to the health of your child.
Exactly, and there's the environment of the womb, which would include the mother's health, how high is the sugar in her blood, how high is her blood pressure, is she drinking alcohol, is she taking drugs, as well as the external environment, which affects the woman. Is she exposed to pollution, smoke, mercury? All of these can cause birth defects. Even stress, can cause, premature birth and poor outcomes in babies.
Part of China's next 5-year plan is improving health care across the country. How much of that will include a prenatal care for women, especially when the government is really trying to boost the birth rate in the country?
Well, I think that in public health, we've now realized that the foundation of health starts in the uterus. In fact, there's actually evidence that children of obese women are more likely to be obese themselves and more likely to have other problems later in life. And so getting that prenatal care, getting that care to the newborn, making sure they're healthy really is essential to having a healthy population.
All right, Dr. Kate Tulenko, always great getting your take, your advice. We appreciate your time.
Thank you.